Hi guys, I wanted to jump on here to talk about ways that you can overcome your fears, because it's something that I've noticed that I've had a lot more of an increase in recently due to people's fears about going outside with COVID or doing things that they may have done. But this technique works for any sort of fear or discomfort that you feel about any sort of thing. So the idea is that you really, first of all, you need to recognize what you are fearful of. So that could be about going to a supermarket, it could be about maybe going to a restaurant, or as I said, it could be just general fears. So a fear of spiders, for example. And what you want to do is to create a list of the things that you are fearful of, and you want to create it with as much detail as possible. So it could be about going to a supermarket during peak times, it could be going to a supermarket at the end of the day, it could be about going to the supermarket with a significant other or someone in your family. And you want to break it down as into small basically make the chunks as small as you can, and within that you want to then rank them how much you're fearful of them, how much anxiety they induce. And then once you've got that list, you want to then start at the ones that are the least fear inducing, or the ones that you kind of feel most able to overcome. And then once you've done that, you then start out the experiments, which is the fun part. So you go and do the things that you're fearful of, and you want to stay in the feared situation for around 20 minutes or more. That reason is because your body finds it really difficult to maintain fear or anxiety for longer than 20 minutes. Your body can't actually produce adrenaline to last at that peak level for longer than 20 minutes. So if you're able to stay in it for 20 minutes, then your anxiety and your fear is going to come down. And then what you want to do is you just repeat this scenario, going up and up the hierarchy, until you get to the thing that's most feared. When you do it, you don't want to just do something once. So say if you're fearful of going to the supermarket at the beginning of the day, you don't want to do that just once. You want to do it until your fear is decreased by half. So if you was to rank it out of 10 in something we call SUDS, which is subjective units of distress. So the first time you do it and then you rank yourself out of 10, you're like, okay, I am at an 8 out of 10 for how scared I am. You stay in that scenario for 20 minutes or more until your SUDS drop down to 4. And then you want to continue to repeat that situation until your beginning number is half the amount of what it was at the beginning. So if your beginning it was 8, you want to do it when you start off and it's at a 4. Once you've done that, then that will be time for you to move on to the next of the hierarchy. And as I said, this is particularly useful at the moment where we may be going back to doing things, or we may be just fearful of things that we used to do all the time. But fear is something that we can overcome. One of the acronyms is forced evidence appearing real, which is something that can be really helpful, because often the fear is our narrative in our head, not actually the feared scenario. And as I mentioned, you can do this with other types of fears such as spiders. So it could be that you start off by looking at a picture of a spider, then looking at a video, then kind of being in the presence of one, until maybe the worst one is it being on your face, for example, a massive one. Or it could be just any sort of thing you're fearful of. So I just wanted to share it because I think that a lot of people are feeling that because we aren't able to really do some sort of the experiments as you would do normally in therapy, but you can still do them. You still got the power to try out these things by yourself. Obviously it's best if you do them with a therapist by your side, but sometimes you don't always need it, particularly when it's to do with sort of the COVID related things, because the fear is more to do, it's situational, it's to do with what everyone's going through in the world. It's a collective feeling, but you're just feeling certain things more. So yeah, just wanted to share that. Hope you find it useful and you're able to put it into practice and to overcome some of the fears or anxieties you might be having at the moment.